Welcome back to Good Things Utah. Okay, moms out there, I know it's spring, we're heading into summer, and I know that feeling of, oh, I wish I had my body back. I wish I could put things here, there, maybe the way they were before babies. We have Dr. Kevin Rose here from the Rose Clinic, and he has help for us today. How you doing?
Excellent.
Okay, what would a mommy makeover be?
Usually it's breast and body contouring. Those are the two things that probably change the most with pregnancy.
So you'd start there, and for a lot of women, breasts are saggier, smaller. There's a lot of extra skin.
Exactly.
So do they come in and you give them, you know, you have the consultation and say, here's what I would do?
Exactly, yeah.
Is that the biggest complaint that women come in with?
Mm-hmm.
Okay.
For sure, yeah.
And then the body contouring, what does that mean?
So usually with pregnancy, the skin of the abdomen will stretch out, and unfortunately, there's not really a whole lot that you can do about loose skin. What you're seeing on the screen right now is a lady who, you know, had about 4 or 5 children, and she just has this little panis of extra skin that's hanging down over the belt. And there's no amount of exercise or you know, dieting that will ever change that besides removing the extra skin.
And that's actually a great thing to say, because I think so many of us say, well, I'm trying. It's just, it's not working. Why isn't it? What diet can I try?
Yeah.
Sometimes that skin just won't go away no matter what.
Mm-hmm. And unfortunately, some husbands are hard on their wives and will say, well, you got to get to the gym, you got to do this, and you got to do that. Well, unfortunately, there really isn't anything that the woman can do to reverse the skin issue. And on the inside as well, the muscles always separate. So the actual abdominal wall, the muscles will separate, and there's no amount of exercises, sit-ups, or anything that will bring those muscles back together. So that's one of the things we do at the tummy tuck, is we bring the muscles right back together, so it flattens the abdomen and narrows the waist.
Is it different for women who have had a C-section? Or is it the same kind of muscle tone loss right there?
It's the same.
Yeah?
Yeah, it's higher up, yeah.
So a tummy tuck or liposuction, what do you usually recommend? What's more popular?
Usually we end up doing a combination of both, because the indication for each procedure is completely different. So usually we're doing liposuction of like the love handle flank area, and then removing the extra skin in the front.
Ah, the love handles.
Yeah.
Oh, the love handles. They just
Gotta love those.
Well, it's that spot, and is it the last thing to go away with exercise and diet too?
Seriously, even I've done liposuction of the love handles even in marathon runners.
Really?
Yeah.
It just
They can
won't
hold on to it
budge.
forever. Yeah.
Okay, so when you do a tummy tuck, do you stitch that muscle back together that's
We
separated?
do. Yeah, with permanent sutures, so you're always right back to exactly the same way you were when you were 17.
So how long until you see the difference? What's the recovery time, the downtime?
So recovery times, you really want to give yourself 3 weeks to feel like you're back at work, you know, I mean, where you could just go back and do most things. But we still restrict your activity for about 6 weeks. We don't want you really going back to the gym and doing any, you know, heavy lifting, bending, twisting, straining.
Let's talk about the 2 pictures we've seen, the one just before and this one, because I swear, moms, look at the camera. This is, you'll see the pictures. This is what so many women complain about. You can even see the stretch marks in this picture too.
Exactly. So the picture, the before, is of course on the left, and the abdomen is sticking out because the muscles have relaxed so much. And so part of what the improvement that you're seeing, I mean, obviously the tummy isn't perfectly flat because there's still some intra-abdominal fat, but you know, that major improvement is redraping the skin that's way up high and fixing the muscles on the inside and removing the extra skin that's down below.
No, you're making so many women feel better right now, because you're right, it is the muscle, that muscle separation. And you've tried everything, and maybe
there's a really, really prominent one right there. That's somebody who seriously had almost like a herniation of her abdomen, and you know, the muscle repair is just dramatic.
Are people just amazed at the afters?
Oh yeah, they're so happy. Tummy tuck post-ops are just incredibly happy. And you know, the breast surgery too really goes along with it, because a lot of the patients, if you only do their tummy, then they just concentrate on their breast. You know, it's good to do both at the same time.
I think it's what is hard for you when you look in the mirror. What you look in the mirror and say, I don't feel good about this. And sometimes it's different areas at different times, but you lose your proportion. Don't you? That's what I found after babies. Your proportion is off.
Exactly.
Let's talk about staying overnight. Is that usually what happens during surgery? And where do you do your surgeries?
Well, at the Riverwood Surgical Center, we do have a couple of overnight rooms, and it's really a safety thing. You know, you probably could go home after a tummy tuck, but why would you want to? When you can stay there, you have a certified nurse who can take care of you, give you medications, just make sure everything is fine. So it's a safety thing.
So we're looking at video of your clinic there in Provo. What sets you apart from other doctors?
Well, I really think that I have a keen sense to detail and artistic, inclination. I think it really takes an artist, I think, to sculpt, tissue. And it's really fun and very rewarding.
It's like putting the pieces of the puzzle back together and making these women so happy. If you want to get a hold of Dr. Rose, he is at the Rose Clinic. He's at 320 West River Park Drive in Provo. You can go to theroseclinic.com for more information. All the phone numbers, everything right there on your screen. But you can also go to our website and we'll link you at abc4.com. Are you busy this time of year?
This is a busy time of year.
Everybody pulling the swimsuits out.
That's
going,
right.
Uh-oh.
You got to be ready.
Thank you, Dr. Rose,
Thank
for
you.
being here. Coming up next, everybody, we are headed into the kitchen, Kimmy's Mountainside Resort here. And I'm sure these are skinny. These are skinny coconut lemon bars, right? Just in time for swimsuit season. We're giving you the recipe next.